Hello, my name is Dermot Ryan. I'm a general practitioner from the United Kingdom. I've been in practice for a long time and I've always had an interest in asthma. Today I'm just going to say a few words about what to expect when you go to see your general practitioner if you think you have asthma. Well, firstly, asthma may be confused with many other diagnoses, so your thoughts about the fact it might be asthma may be contradicted. For example, it may be heart failure, or it might be anemia, or there are many other causes of similar symptoms with which you present to the doctor. You will tell your story to the doctor and he will listen to you, looking in particular for a history of cough, wheezing, shortness of breath, particularly on exercise, and chest tightness, a feeling of constriction around your chest. He'll also ask you if the symptoms are worse at any time. Oftentimes, if asthma is not controlled, the symptoms are worse at night time. And with people with hay fever, they may have asthma symptoms only during the hay fever time of year. When he has got some ideas in his head about what's going on, he may examine you. This will consist of looking at the rate at which you're breathing, whether you're having any difficulty in breathing, checking your pulse rate, listening to your chest, listening for abnormal sounds, in particular listening to wheeze. And then he may do some tests on you. That's always very useful to do some lung function tests to determine whether the diagnosis is correct. If you're having symptoms at the time of day when you're seeing the doctor, he may do them then and there. He may do a peak flow reading, give you some short-acting medication, and check your peak flow reading a few minutes later and see if there's been a big change in that reading. That can help make a diagnosis of asthma very, very quickly. If you haven't got any symptoms at the time, there may be no signs at all. In which case he may give you a peak flow meter and ask you to go home and record the peak flow first thing in the morning and first thing in the evening, and to record the best of 3 readings and to come back and review the answer to that. With this, you're looking for a big variation between the morning and the evening in the peak flow. We all have a variation in our peak flow from morning to evening, but if you've got asthma and it's uncontrolled, that is much greater and also helps make a diagnosis of asthma. There's also the possibility of doing spirometry, which is a much more sophisticated test which takes quite a bit longer and probably involves spending 3/4 of an hour at the doctor's surgery. If the GP has decided you probably have got asthma, he or she will start you on some medication. This will usually be a treatment which contains a medication to open up the airways, a bronchodilator, coupled with an inhaled steroid. The inhaled steroid reduces the inflammation or the swelling of the airways, stopping the narrowing of the tubes, which is causing the symptoms in the first place. He will check that you know how to use the inhaler and tell you to take the medication, generally speaking, twice a day. And sometimes an extra time or 2 during the course of the day if the symptoms come back. Normally, the doctor will review you in 2 or 3 weeks' time to see how things are going. You may be very much better, in fact you may be well. You may be improved, or you may not have improved at all. If you haven't improved at all, this may be because you're not taking the medication regularly, you're not taking it properly, or because the diagnosis is not correct. If the symptoms are partly improved, the doctor will ensure that the inhaler technique is correct, that you are taking it twice a day at least. And if that is the case, then look for other things which may be going on, causing your symptoms to persist, such as uncontrolled hay fever or carrying on smoking. Or maybe you're better at weekends, but not during the week, which points to the fact that there may be something at work that's causing your asthma to get bad. So at each subsequent visit, the doctor will do something different to look and see if they can improve your asthma. And if they can't, after a period of maybe 2 or 3 months of visiting the doctor 3 or 4 times during this time, the doctor may decide to send you to see a specialist. To see a specialist in order to check the diagnosis is correct, or to check whether you need other treatment which isn't necessarily available in primary care. There are no quick solutions in many ways because a diagnosis is not always easy and it takes time to put the pieces together of the jigsaw puzzle in order to ensure that the diagnosis is correct. Time is a great indicator because asthma is a variable disease and it does vary over time. So there may be times, long periods of time, when there are no symptoms and there are times when the symptoms are there. So I hope that's given you a quick overview of what might happen to you when you go and see your doctor, and also understand some of the difficulties a doctor has in making a diagnosis. We all want an instant diagnosis, so treatment may begin and we may be relieved of our symptoms straight away. But it's important to put that into perspective and ensure that you get the treatment that you need when the diagnosis is correct. Thank you for taking the time to listen to me.